We are totally breaking the mold of the Foundation 3 this week. We're in Nashville at the Health RosettaFest. And so what we're doing here is we're going to interview a couple of friends of mine that I think are great agents that are up in the northwest part of the country. So as we interview these people, we're going to talk and ask them 3 questions. Question number 1 is, what's gold? What are the things in health plans that are really working well or saving money? What's fool's gold is going to be the second question. What are those things that people think are working, that are good things that really aren't worth their bite? And then the last thing is something smart. What is something either you're doing or should be doing or need to be doing in your health plans moving forward? So let's get going. Introduce you to Rachel Hawkins. She has an agency out in Washington, and she and I were actually in the same Health Rosetta cohort 3 or 4 years ago, and that's how we met. So, Rachel, what is your goal?
I would say the goal is we are no longer buying health plans. I think it's really going to come down to we are building them, and that's going to involve the right partners. That's part of the ecosystem that I think sets Health Rosetta Advisors apart, is we're picking the right partners that are going to be aligned with the employer's goals and to achieve the outcomes that they're looking for. So customizing that, building that, and no longer just purchasing insurance.
What's the fool's gold?
The fool's gold is I think there's still people out there that are simply like, hey, I'm used to having my annual renewal, and whether it was a savings and looking for a cheaper option, they're still on that mindset of an annual cycle, and they really need to be looking at a long-term strategy.
3, 4, 5 years.
3, 4, 5 years. That's
Absolutely.
the strategy, because people need to have the mindset shift of sustainability and get over this up and down and up and down. And I see that so often that people are still stuck in that mindset. It's not that way anymore.
No, not at all. And then the last thing is, what are smart brokers doing or smart clients doing when they're thinking about their benefits?
Well, I think that AI has been a big part of the industry shift. And one of the things that I foresee happening in the future is being able to take data that's coming in from claims and utilize that through AI processes for better predictions of renewals that are specific to employers. Not just this, hey, I got a rate increase, well, why? I don't know. Well, we're going to have more actual data that it translates into, this is what we're seeing as cost drivers. How can we intercept these claims and prevent double-digit rate increases at renewal? And being able to tackle that ahead of time. I think that utilizing AI is going to be a big driver for these outcomes.
I agree. And we're starting to use it more and more in our agency. See, running around with smart people like Rachel. All right, so I'm here with one of my other good friends, Lindsay Clark Youngsworth. She has a agency in Idaho, and it's called Keenly. Yeah, so let's go into the questions. All right, so what's your goal?
My goal is any type of cost containment solution that you could implement on top of your fully insured plan that helps to develop the habits within your team to really make any additional strategies that you deploy even more powerful and successful. Also helps to lower costs so that moving into self-funding is also easier and lower cost.
Okay, that's a good one. Mm-hmm. What's your fool's gold?
Any type of one-off benefits, $2 PEPM here or $3 PEPM there, and they're always really cool. Everything is perfect in a demo, Jonathan. And but the challenge is, how do you get this information out to your employees? And many of these tools come, but they don't have an engagement campaign. And I would say any type of solution that you implement for your group that does not have a partner that has already built out an employee engagement program that you could easily implement, because the intention is to save you money and to help make your employees' lives better.
I agree with that. I call them bolt-ons, so I'm not a big fan of bolt-ons either. So what's the one thing that smart people are doing that you think either other brokers should be doing it or other employers should be doing it that you think is just a smart thing?
I would say putting a cap on your infusion therapies in your self-funded plans at $250 or $350 for each infusion therapy, and also removing the facility fees for your infusion therapies.
Okay. Thank you so much.
Thank you. Oh!
I like to say we're the helpers, but we're not the helpers. We're the guys that are on the sales side. But let's talk about the helpers. Vanessa. Of course, I think she's awesome. And she is so good and so thorough and follows through on everything that she does. If she's the one helping you, I am 100% sure it's going to get done.
Peyton is another great helper. Me and him share an office, and I hear him doing on the phone, new hire enrollments, answering the phone, and just being as best as he can.
Yeah, and I'll talk about Carol. Carol's my girl. She answers every question. She takes care of everything, and I've never seen someone juice a carrier as much as Carol does. Carol will get everything out of a carrier but their social. So that's my girl.
So we're not the helpers, but we have 3 great ones. Thanks so much, and we'll see you next week.